COVID patients on the ward, and they met a nurse, a single nurse who was on duty. It is on record that when they came in, they did not consult with the nurse. They proceeded straight with their procedure. However, the nurse, in her magnanimity and out of respect, went ahead to meet them and joined them, assisted them in the procedure, and as the procedure was done, she proceeded to document her own findings too. She drew the attention of the team, not on one occasion, not on two occasions, not on three occasions, to the fact that the waste that has been generated needs to be discarded. Hence, they acknowledged that that should be done. But as time went by, they all proceeded out, and she was left with two of the medical officers, the physicians, one senior registrar and the house officer, and she drew the attention once again to what they have failed to do, which they snubbed or ignored her. And from there, they proceeded to move. And there is an international convention that states that whosoever generates waste must, as a matter of urgency, discard such waste. And of course, it goes just beyond mere statement. It even quotes the World Health Organization states that an individual who generates waste is financially and legally liable to dispose that waste. Now, let me ask you, Mr. Femi, if you go to defecate or use the restroom or the convenience in your house, would you leave it there and call someone else to help you flush it? You and I know that you wouldn't do that. And that is exactly what is playing out here. Sharps are one major source of contamination and infection all over the world. Hepatitis B, COVID, and all that seriously contaminating infections are spread through use of sharps. And it is a standard practice anywhere that such sharps must be discarded. And so as you segregate, and when you use the word segregation, we are looking at selecting the waste into the various sections. These are highly harmful, these ones are highly toxic, these ones are safe to be discarded, and from there you proceed to dispose it in their designated points. Needles and any other sharp are meant to be put in the sharp linen box, which was placed right there beside the trolley. Any other waste other than sharp has a collection point. My brother, let me let you know that the health attendants do not have the right to come onto the ward to pick something on the trolley. Every job, every professional has a boundary where their job starts and where it ends, especially when it comes to the issue of sharps. Let me cite an example. In our various houses, we generate waste. We are liable to dispose it. But are we the ones who go directly to dispose it at the collection point? No. We put it in the garbage bin outside our houses, and then the waste collectors pick it up from there. If we apply that to this scenario, what our colleagues are on the other end are telling us is that the waste collectors should come into our bedrooms, into our kitchens to collect the waste, and that is not possible. It is wrong. Once we have told them, we made it very clear to them, we are not fighting anybody. This is an issue of principle. It is a duty of care we owe to our patients, because such waste constitutes serious harm to the patient they just operated on, to the patient relatives who are coming in, and then to other healthcare professionals. How am I to know what you have packed together in your waste bin, under the trolley? Moreover, the lower trolley is not meant to collect waste. It is meant to collect used items like used instruments. So when we are saying, oh, that's where we're supposed to use to dispose waste, I don't know where that comes from. That is almost clear that there is a lack of understanding on waste disposal protocol.
All right, so I mean,
it will interest you. Let me wrap it up. Okay. It will interest you to know that in 2013, the year 2013, we had a seminar in the hospital organized by the hospital on waste disposal by the Federal Ministry of Health, and it was clearly stated, very, very clear, that whosoever generates the waste should properly dispose of it in the interest and safety of all members of staff and the patient at hand. And that is the stance of the nurse.
All right. So, I mean, clarifications are for those who understand, who do not or who are not familiar with the workings of the hospital, and the relationship between the different professionals in the hospital environment. What constitutes a waste?
Right. There are so many things that constitute medical waste. You could have blood, you could have tissue, you could have solids, you could have used items like cotton wool, gauze, All these constitute medical waste. Needles, syringes, all these are medical waste. And that is why the term segregation comes into play. Identify the ones that are harmful, the needles, the tissue. Nobody has access to touch live tissues or remove tissues, excise tissues. All those ones are segregated aside. You bring them separately and then proceed to package them and dispose of them separately. If you connect, or if for any reason you have a procedure where you remove tissues from the human body, there are collection bags for such tissues and there are appropriate ways of discarding them. When it comes to needles, there are ways of discarding used needles. As a matter of fact, it was during that seminar that we introduced retractable needles just to limit the risk of injuries, needle prick injuries.
Because yes, okay, yes, I'm with you. But I want to come in here. The statement by the doctors, they said that, and I quote now: the team on arrival at 4:30 p.m. informed the nurse on duty, and they said that after the procedure, the team discarded appropriately all sharps used. They wrapped the empty kit with the drape used and kept on the lowest shelf of the trolley and wiped the topmost part of the trolley clean and moved the trolley away from the patient's bedside. End of quote. You're saying that was not enough?
Mr. Femi, I can tell you on authority that is an afterthought. No nurse will challenge anyone if they have done what they were supposed to do appropriately. We have evidences which, unfortunately, is already in the media, where the needles, the tubes that were used for the procedure were placed on the trolley. It is no news also that there are a lot of procedures that have been done in this country where you would see needles on the bed, which constitutes serious harm to the patient. And then, for us as an association and of course as nurses, we owe it as a duty, matter of duty, to protect the interest of our nurses and then the general public. In this case, if any case at all should go to court that will involve the nurse will be held liable, because the nurses are one of the very, very few people who are authorized by law to stand in for their patients, to advocate for their patients, and that is what our nurse has done. You are constituting a hazard to our patients. You are constituting hazard to the patient relatives. You are constituting hazard even to other healthcare workers. All she simply did was to draw their attention, and she held on to it. We are also taking down memory lane. When Patrick Sawyer of Best Memory came in from Nigeria and got in contact with one of our nurses, Nurse Ejeloni, if she had not raised attention an issue which she escalated to our medical directors at then, the late Stella Adedebo, and she had to arrest the man on the bed there. If she hadn't done that, because she also knows that she owes the country a duty of care to protect every one of us. Who knows whether we will be alive today during the Ebola saga? If she could have done that in the best interest of the public to protect everyone, then why are we now saying this same nurse here who had taken a very good step to protect every one of us, including you and I? Why are we now saying she has done something wrong? Especially where it is very obvious that the medical team, who should know by virtue of their training and by virtue of their experience, that they are meant to discard all these ways. That has been our position.
All right. So I want to talk about the issue of the health attendant again. I spoke to the president of the ARD and he said the institution disposes the waste, and there are different personnel for some of these responsibilities. So there are health attendants whose responsibility is also to dispose the waste. But you are saying that the health attendant cannot come into the hospital ward. Is that what you're saying?
No, you don't get me. Everybody has their own boundaries. Every job responsibility is spelled out to some extent. Yes, we don't have a full job description in our country. However, by virtue of training, there are boundaries to where everybody's work starts. Now, for the healthcare attendants, which we have referenced, healthcare attendants' job is to make sure the environment is clean. That is one of the core responsibilities of the healthcare attendant, to ensure that the environment is clean, and then to dispose of waste which has been segregated and duly discarded. In the ward, in the setup of the ward, you can come into the ward and see, you have designated boxes in the ward. You have the ones for sharps, you have the ones for other waste, and if there is any tissue, those tissues are sent to where it's going to be analyzed at the histology lab. These are ways of disposing it. So Now, the doctor claims that they have dropped the waste or they have discarded the waste on the trolley. I beg to ask, is the trolley the waste bin? I beg to ask, is the trolley the sharp box? The trolley cannot serve that purpose, and that is why no cleaner or no health attendant will come to the ward to come and pick items on the trolley because the trolley is out of our boundaries.
So if I get you right now, doctor, you're saying the trolley is not where the waste is to be discarded. There are different places where the waste are to be, and you're saying that's a standard operating procedure.
Yes.
So
the trolleys are meant for procedures. Waste are meant for waste bins and sharp bins, depending on what was used for such procedures. My brother made reference to the theater. Let me shed a little light on the theater. The theater is an interesting environment where a whole lot of professionals come to play and then work on the patient. But I can tell you on authority that no John would come to the theater, wrap up his procedure, and leave the sharps and other scalpel that he has used, which constitutes this waste, on the bedside of the patient, on the trolley. They go ahead to discard it instantly because they know the rules and regulations guiding the use of the theater. Then the porters only come in after the surgery has been done to evacuate it. If we are to follow the line of what our brother physicians are saying, it means that as they generate in the course of the surgery, where blood comes out, the doctor should come there and have it more done. Is that possible? It's not possible because you are going to be contaminating the surgery field. And that is why at the end of the day, once the surgery is done, all waste are properly discarded, then the health care attendants will come in, tidy it up, and we are ready again. And that has been our stand.
Well, I mean, so the waste, when you've generated the waste, you are insisting should not be left on the trolley. It should be discarded in the designated boxes or places within the ward, from where the health attendants will now come and evacuate and dispose properly.
Yes, Mr. Femi, nurses also carry out procedures. Let me educate you on that. As nurses, we carry out a whole lot of procedures on the ward. And I can tell you on good authority that you would never come to the ward and meet any used item on any trolley. That is because we duly understand that we have a right to protect everyone, including the physicians themselves. And that is why once you are done with any of your procedure, it is mandatory that you discard everything you have used and then make sure the trolley is clean. That is what we have been doing and will continue to practice as nurses.
All right. So, working as a team of doctors and nurses, after performing whatever procedure and concluding the procedure, is it not the duty of the nurse to dispose that waste? You're saying it is the duty of whoever has used such equipment or generated such waste to dispose it, not that of the nurse if she is a nurse on the team with other doctors and other professionals there.
Let me start by making a clarification.
Okay.
Nurses are not bound to attend to doctors on their rounds or on their procedures. This is because by international statute, nurses are independent profession. It is recognized that nothing is sui generis. In other words, it is second to no other. It is a standalone profession that can only work on its own and then interrelate to other professions. That is one. And having made that clear, we will work as a team. Whatever you read are bound to discard. The nurse who assisted them in draping the patient, in screening the patient, who assisted them in cleaning up all the other things that they left, including blood stains, had.
Oh my! The line went off there. So perhaps we just reconnect so that we can conclude this conversation and then go to the phone lines to get you join us. So we're trying to bring back Mr. Olawale Ajayi, who is the chairman of the National Association of Nigerian Nurses and Midwives, Oauthc. Okay, so Mr. Olawale Ajayi is back on the line. Okay, thank you. The line went bad at that point. So you are about concluding, explaining to us the processes.
Yes. So the nurse at that point, who had assisted them in all those things, had discarded all the waste she generated. She is not the one with the scalpel. She is not the one with the cannula. She is not the one making use of all that. It is the person who has done that is expected to start such. This is standard practice world over.
All right.
It's not a Nigerian thing. It is the standard practice world over. And what she has done, if not an infringement on the right of the physicians as claimed, the right of the physician cannot in any way constitute a harm or hazard to the rights of other members of the team and that of the patient. And we have a slogan in the healthcare team: the patient is number one.
All right. So, Mr. Ajayi, yes, because of our time, I want to ask you a final question. So I've had different people weigh in on this matter and said, okay, so two wrongs do not make a right. So if the physician that performed the procedure had erred by not disposing the waste properly, was it right for the nurse to have locked up the doctor? Could she have reported or followed another process of reporting, that particular action instead of locking up? Say two wrongs do not make a right. How do you react to that, sir?
Unfortunately, we only have one wrong thing here, Mr. Femi. And the wrong thing we have here is the fact that the doctors put every one of us and the public in danger. The nurse, having understood that she owes it a duty of care to that patient and to everyone, and having understand the legal implication of letting that thing continue, raised an objection and then went ahead to hold them back. She did not lock them inwards. She was part of them. She was inside the place with them. She didn't lock them out. She didn't lock them in and then stay outside. And she kept insisting, please clean this thing up and we'll go. Moreover, it's also interesting to know that the nurse in question put a series of calls to our immediate supervisor, to our to our ward leader, who even attempted to talk to the team, but it was revoked. And this was as well communicated to the units, another change of communication. Now tell me, what has the nurse done wrong? She has communicated it, she has addressed them, and yet they refused to do that.
All right, so
if every one of us has been ignoring all these tenets, it is that it's a matter of time an epidemic will blow out in the country.
All right, so
we'll pay for it.
Yes, sir. So just before I let you go, the hospital management has waded into the matter. There's a fact-finding committee. So what's the situation now at the OAUTHC Leife?
We have. Let me state by we have been a very family. Nurses have tolerated a whole lot that my sister profession would never take, and that has been our position because we recognize the fact that you may not have the best of environment, but you can make do with whatever you have and give the best of care, and that is what we have been doing. Okay. Even in the face of obvious harassment and intimidation, we have still maintained our ground and we have continued working. The fact-finding committee has indeed been set up by the management and they are working. Although we still have reservations about it, but we are still following the internal mechanisms of resolving this issue, and we are following it. And that is what we expected of our counterpart.
What's the reservation that you have, sir? What reservation do you have?
I will not be able to disclose that because it is subject to the management, and the management is working towards it.
All right. Okay, because of our time.
Always.
Yes. Okay, so we'll just let you go, but we'll keep tabs on this development. But we'd like to thank you most sincerely, sir, for joining us and talking to us and shedding light on this issue in the hospital. We do hope that there'll be continuous harmonious relationship between amongst all of the health professionals in the hospital sector in the OAUTHC. But thank you for talking to us on Frank Talk on Brave 91.7 FM, Mr. Olawale Ajayi.
Thank you very much for having us.
Thank you very much, sir. Thank you. Mr. Olawale Ajayi is the chairman of OAUTHC unit of the National Association of Nigerian Nurses and Midwives. Let's take one or two calls before we go this morning. Hello, good morning. Hello. Okay, let's see. Perhaps WhatsApp messages. Hello, good morning. Hello. What's your name? Where are you calling from?
Good morning.
Please speak up so that we can hear you. Okay, that dropped. Hello, good morning.
Hello, good morning.
What's your name? Where are you calling from?
Yes, I'm Ayobiji calling from Ushogbo.
Thank you for joining us.
Yes, thank you for bringing this program. I've listened quite carefully to the two parties. We can see that there is a chronic animosity within the hospital setting. And of course, when someone is now saying the only one thing that is wrong is an individual locked up someone on the ward. Let's be sincere for goodness sake.
All right. Okay. So the last call here. Good morning. What's your name? Where are you calling from? All right.
We should have more work than that. Then we shouldn't carry our work people that we are working.
Okay, so I'm afraid the line's acting funny. We need to run. But I'll be back here on Monday for another edition of the show. But Thompson will be here tomorrow for Thompson and the Gang by 7 a.m. Femi Olanikwekon is my name. Good morning.